The truth about C-sections, what every expectant mother should know. C-section is a surgical procedure in which the baby is delivered through an incision in the mother's abdomen and uterus. It is usually recommended for women with certain medical conditions or complications, or when vaginal birth would pose a risk to the mother or baby. While a C-section can offer a more controlled delivery environment and reduce the risk of some birth injuries, it is a major surgery and can come with some risks and a longer recovery time. Recovering from a C-section can take time, but with the right care and support, you can make a full recovery and get back to your normal routine as soon as possible. Here are some tips to help you recover quickly and safely. First, it's important to rest as much as possible in the first few weeks after surgery. Your body needs time to heal, so don't push yourself too hard. You should also take pain medication as prescribed by your doctor to manage any discomfort or pain. Gentle exercises, such as walking or stretching, can also help to promote healing and reduce the risk of complications like blood clots. Eat a healthy, balanced diet with plenty of protein and fiber to support your body's healing process. Eating foods that are rich in vitamin C, such as citrus fruits, strawberries, and bell peppers, can also help with wound healing. Drinking plenty of water can help to flush out toxins and promote healing. Avoid heavy lifting or strenuous activity for at least 6 to 8 weeks after surgery to give your body time to recover fully. Ask for help from friends and family during this time. Finally, keep an eye out for signs of complications, such as excessive bleeding, fever, or severe pain, and contact your doctor if you experience any of these symptoms. How long does it take to walk after C-section? The timing of walking after a C-section can vary depending on several factors, such as the individual's overall health, the type of C-section performed, and the presence of any complications. In general, it's important to start walking as soon as possible after surgery to promote healing. Most doctors encourage patients to start walking within 24 hours after a C-section. Initially, the walking may be slow and uncomfortable, and the distance may be short, such as from the bed to the bathroom or around the hospital room. As the days pass, the walking can gradually increase in distance and speed. It's important to listen to your body and not overdo it, as pushing yourself too hard can lead to complications. Going home after a cesarean birth. Going home after a cesarean birth can be both exciting and overwhelming. Typically, patients stay in the hospital for about 3 to 5 days after a C-section to monitor their recovery and ensure that there are no complications. Before going home, the healthcare team will provide instructions on wound care, pain management, and activity restrictions, among other things. They may also recommend follow-up appointments with a healthcare provider to monitor the healing process. Once home, it's important to follow the healthcare team's instructions carefully and to rest as much as possible. It's a good idea to have a support system in place after going home, whether it's family members, friends, or a professional caregiver. They can help with household chores, meal preparation, and childcare, allowing the patient to rest and focus on recovery. In addition, patients should monitor their incision site for signs of infection, such as redness, swelling, or discharge, and contact their doctor if they experience any unusual symptoms or have concerns about their recovery. Will having a cesarean affect future pregnancies? Having a cesarean birth can affect future pregnancies, but the extent of the impact can vary depending on several factors. One consideration is the presence of any complications during the C-section, such as excessive bleeding or infection, which can increase the risk of complications in future pregnancies. Multiple C-sections can increase the risk of placenta previa, where the placenta covers the cervix, making vaginal delivery risky. However, in many cases, a C-section does not have a significant impact on future pregnancies. Patients who have had a C-section can still have vaginal births in the future, although their doctor may monitor them more closely for any potential complications. It's important to discuss any concerns about future pregnancies with your healthcare provider, who can provide personalized guidance based on your individual health and medical history. They may recommend additional tests or monitoring during pregnancy to ensure a safe and healthy delivery. Overall, while having a C-section may increase the risk of certain complications in future pregnancies, most patients are able to have successful pregnancies and deliveries with the right care and support.